Alright, today we're going to talk about insulin resistance. I'll see you inside. Now, insulin resistance isn't really a diagnosis, rather, it is just a construct, meaning that your cells are becoming less and less responsive to the same amount of insulin. So, for a pretty good period of time, it was thought that the reason that diabetics had issues with their blood glucose getting too high was because they didn't have enough insulin inside of their body, so they were given more insulin. And now, for a brief period of time, insulin did seem to help lower their blood glucose, but it seemed that these patients had to continue to increase their insulin dosage as time progressed, the longer they were taking insulin. So these individuals might have been able to start out with 1 unit of insulin to get their blood glucose down to their normal range, but within a few months they were forced to take 2, 5, 10 units of insulin in order to get the same effects, which pointed at the fact that there was likely an underlying issue that wasn't not having enough insulin, but maybe a miscommunication between insulin and its receptor. So it was perceived that it was actually the pancreas that was shutting down and not producing enough insulin, but more and more research has come out that a lot of diabetics actually have profoundly high levels of insulin. And now more and more research is coming out that it appears that diabetics have a lot of insulin, but they don't have a lot of insulin receptors. What I mean by this is that on the membrane of a cell, there are insulin receptors, and insulin actually must bind to this receptor to turn on the intracellular cascade that insulin's actions are predicated on. Insulin doesn't actually go into a cell. All it does is bind to a receptor, and then inside the cell will actually shuttle different glucose channels and nutrient uptake channels to allow the nutrients and the molecules inside of the bloodstream to be sucked into the cell out of the bloodstream. What this means is that for a bolus of insulin to do anything, you must have a properly functioning receptor, or at least enough of them for the insulin to actually bind to. And now this is where the concept of insulin resistance comes in. Everyone has what is referred to as a personal fat threshold. And this is the amount of body fat that your cells are able to accumulate before they begin to get overstuffed and begin to get inflamed. And when they begin to get inflamed, they actually have mechanisms to prevent more fat from accumulating inside of the cell. And one of these mechanisms is to actually decrease the number of insulin receptors on the membrane so that insulin can't facilitate more nutrients into the cell. And it actually appears that this is highly genetic. It appears that Asian individuals seem to have a much lower fat threshold than a lot of Americans. And while I'm unsure why this is the case, Asians seem to develop diabetes at a much lower body weight than an American would. And this is why you can find some overweight individuals who have perfectly normal blood glucose levels, because their cells are simply able to uptake more fat and store more fat without getting inflamed. Therefore, they won't begin to become insulin resistant as easily. So giving people more and more insulin actually seemed to be doing the opposite and making the issue worse because we were reducing the amount of insulin receptors we had even more. And this is kind of the basis of diabetic medications like metformin and berberine that do not actually work to increase the insulin, rather they help increase the function and quantity of insulin receptors. And now this is what most people would refer to as non-physiological insulin resistance. This is simply when you expose your body to so much insulin over a long period of time that you accumulate too much body fat and you surpass your personal fat threshold, and your body begins to downregulate the insulin signaling to stop putting more nutrients inside of a cell. However, it does look like there's such thing as physiological insulin resistance, and this actually occurs when you go on an extremely low carbohydrate diet and you have extremely low levels of insulin for a period of time. The body is this efficiency machine, and if there is no need to maintain a specific piece of cellular machinery, it will not put in the energy to do so. And if you decrease the amount of insulin signaling or insulin production you have on a daily basis, the body will actually begin to reduce the amount of insulin receptors it creates because it simply is not necessary to have an abundance of these receptors. And if you begin to fuel your body more on ketones and body fat, you will actually reduce the amount of enzymatic machinery that you have to metabolize a large amount of glucose. And now this spares energy so that you can make more of the enzymes required to metabolize ketones and fatty acids. And now this is the basis of keto adaptation, where if you've been fueling your body on glucose for a long period of time, you don't really have an abundance of the enzymes required to metabolize ketones. So there's a period of time between when you start a low carbohydrate ketogenic diet and when you actually have enough of the enzymes to really use the ketones for fuel effectively. And the same is true in reverse. If you've been on a ketogenic or low carbohydrate diet for a long period of time, you will actually upregulate your fat metabolizing enzymes and downregulate your glucose metabolizing enzymes, along with the insulin receptor, because on a low carbohydrate diet, if you're not eating an abundance of protein and going through a lot of gluconeogenesis, you likely will not have much insulin being produced. Therefore, there is no requirement to maintain an abundance of insulin receptors. And if you quickly convert back to eating a lot of carbohydrates at once, you may feel that you are unable to digest them and you have much less energy. And it's simply because your cells may not actually have the enzymes and the receptors required to efficiently use the glucose for energy. And now it doesn't seem that converting back to using glucose as energy takes as long as it does as adapting to a ketogenic diet. You seem to be able to pull yourself out of this physiological insulin resistance in about 5 days. But if you had a continuous glucose monitor, for the first few days, you'd actually see that your blood glucose remains a little bit higher than normal. And now both of these two constructs are referred to as insulin resistance, and the former, being non-physiological insulin resistance, is probably much more prevalent and much more dangerous than the latter. And I think this just demonstrates how smart the human body actually is. And the most important thing is that none of this should be taken as medical advice, and you should consult with a professional before making any changes to your diet or supplement. And I hope this podcast was interesting, and I hope to see you back on the next podcast. All of the links to my social media platforms will be in the description, and I hope you enjoyed. Thank you for listening.